Hello and welcome. Today we are diving into a technology that is poised to completely change how we prevent DKA, continuous ketone monitoring. For anyone managing patients at risk for diabetic ketoacidosis, you're really going to want to pay attention to this.
All right, let's jump right in. We're going to cover why CKM is such a game changer, walk through the brand new international guidelines, talk about which patients are going to benefit the most, take a look at the current devices out there, and then see what's on the horizon for this technology.
So first up, let's set the stage. We're not just talking about an incremental improvement here. We're talking about a technology that plugs one of the most dangerous and long-standing gaps in diabetes management.
Despite all our advances with things like CGM, DKA is far from a solved problem. It is still a major threat. Hospitalization rates are stubbornly high, and we know that just one DKA episode can be a grim predictor of future problems, like cardiovascular events or renal failure. We absolutely need a better tool.
And this right here, this shows you the sheer power of what we're talking about. This is from a case study where a blinded sensor picked up a life-threatening ketone level a full 20 hours before the patient was even hospitalized with DKA. Just think about that. What could we do with a 20-hour head start? The clinical implications are just enormous.
And the need for direct ketone monitoring is only getting more urgent. Why? Well, because of euglycemic DKA. With the rise of SGLT2 inhibitors and in high-risk groups like pregnant women, we're seeing it more and more. And you know the challenge here. It's DKA, but with normal glucose levels. It's incredibly sneaky, and a CGM alone is completely blind to it. It's just not enough anymore.
Okay, so if this technology is so promising, how do we actually start using it in a standardized way? Well, a huge step forward just happened. The first ever clinical guidelines for CKM were published by an international panel of experts. This gives all of us a solid framework to start from, even before the medical-grade devices have hit the market.
So what did they come up with? A really simple, really actionable traffic light system. Think of it this way. Below 0.6 millimoles per liter, you're in the green. That's normal. From 0.6 up to 1.5, that's yellow or elevated. Get above 1.5 and you're in the orange zone, high. And then you have the red zone, the critical one, urgent, high. It's a system that's designed to be intuitive for both clinicians and our patients.
If there is one number you take away from this today, it's this one, 3.0. 3.0 millimoles per liter or higher is urgent high. At this point, immediate medical attention is required. The guidelines even recommend a mandatory, not optional, alarm at this threshold. This is the stop everything and act now number.
Now, this is a really important point for patient education, and it's a bit different from what we're used to with CGM. The panel was very clear. Patient actions should be based on the absolute ketone number, not the trend arrow. For us, the rate of change is still clinically useful, of course, but for the user, this simplifies things tremendously and frankly makes it safer. The number is the trigger, period.
All right, so with these new guidelines in our back pocket, the next question is pretty obvious. Who needs this technology the most? Who are the priority patients where CKM is going to make the biggest, most immediate difference?
The panel identified a few key groups. First, patients with recurrent DKA. This is a no-brainer. Then you have those on SGLT2 inhibitors or pregnant women, both at a much higher risk for that tricky euglycemic DKA we talked about. And, of course, our insulin pump and AID users. For them, CKM is a critical safety net against a pump failure, a clogged catheter, or a bad infusion site. This is a huge deal for them.
So, we've got the why and we've got the how-to. But what about the what? Let's talk about the hardware itself. What do you need to know about the regulatory status and what's actually available right now? Okay, this is probably the most critical distinction we need to make as clinicians right now. As of early 2026, there are no approved medical-grade CKM devices. Let me say that again, 0. The devices you might see advertised online, those are consumer wellness devices. They're for lifestyle tracking, not for diagnosing or managing DKA. It is absolutely vital that we make this crystal clear to our patients.
And this table really lays it all out. The one to keep your eye on is the Abbott Dual Sensor. It measures both glucose and ketones, and it has FDA breakthrough designation, so it's in the pipeline. But then you have something like the Sibio KS1, which is a wellness CKM, and devices like Lingo and Stelo, which are CGMs for metabolic health, not ketone monitors. Know the difference. So with the guidelines in place and the technology just over the horizon, we are truly standing at the dawn of a new era. But the consensus panel was also refreshingly honest about what we don't know yet.
And this, to me, is where it gets really exciting. These are the next frontiers. Can we eventually create risk profiles for ketones, similar to time and range for glucose? What does a normal day of ketone fluctuations even look like? What's the lag time between blood and interstitial ketones? How do these CKM readings actually correlate with acidosis markers like bicarbonate and pH? These are the huge questions that this incredible new data stream is finally going to help us answer.
And that really brings us to the final thought here. For decades, we've been looking at ketosis through these tiny little snapshots from a finger stick. Now, we're about to see the whole movie in high definition. So the question isn't just about preventing DKA anymore. It's much bigger. It's about how this constant flowing river of data will fundamentally reshape our entire understanding of metabolic health and diabetes. The future is coming, and it's going to be fascinating.